The short answer is yes. And then there's a longer answer, which is that generally speaking, and most of this information is based on clinical experience because we don't actually have studies that compared autistic people and non-autistic people head to head, giving them the same medications and then measuring side effects. However, we do have studies of autistic people measuring rates of side effects, and they have higher rates of side effects for psychiatric medication across the board, essentially, not just for OCD medication specifically. Autistic people tend to have more side effects, more idiosyncratic or unpredictable side effects. Giving just a little more specifics on there, autistic people tend to be more likely to experience activation, like an edgy, overly caffeinated, sped up experience from SSRIs and SNRIs. Autistic people tend to experience more irritability on stimulants for ADHD. Also, there's data that they experience more weight gain and sedation from antipsychotic meds like aripiprazole. So, does that mean that we don't treat them with medication? No. Medication can be extremely effective and life-changing for autistic people. With OCD, it means that we need to be more curious and open to unexpected side effects when they happen. We need to be more persistent in trying different medications. April had a comment. Do you want to clarify the comment maybe?
I was just responding to question about, does dosage of medication make a difference for autistic people?
I think that's true. I mean, okay, because of the enhanced sensitivity to side effects, we do recommend starting at lower dosages, but our therapeutic dosage that we're aiming for is still just as high. That being said, there are people, it's all unique to each person. There are people who respond to a tiny dose, which usually doesn't make sense for OCD.
I had this as a secondary question, but maybe you want to just tack on the response here as well about how does interoceptive sensitivity play into the experience of those side effects?
So I think
and
it's
what
really
do you do
great,
as a provider to like help people navigate that?
So there's so many things at play. There can be both decreased interoceptive sensitivities. So you're like, I didn't realize I had pain until I almost had a ruptured appendix. And there can be increased interoceptive sensitivity, such as, my stomach was just slightly off because I needed to have a bowel movement and I was like dysregulated. What the heck is going on with my body? So both ends of the spectrum. And that is certainly going to impact people. I think also with people who have less interoception, it may be harder for them to figure out how effective the medicine is or their side effects on the medicine. Add to this, we do have data that populations of people who traditionally have felt powerless or unheard, which many autistic people do feel, like less autonomy, less understood, less heard, tend to have more side effects because they expect harm. They expect to be harmed by authority figures. We call that nocebo effect. So placebo effect is you expect a medicine to benefit you, and so that enhances the benefit from the medicine. And then nocebo effect is I'm used to not being trusted or listened to, heard, or given autonomy in my healthcare professionals and other authority figures. So I'm expecting to be harmed by this medicine. Therefore, my side effects are more intense, and it doesn't make them any less real.
Another aspect of this that I think was touched on momentarily was the idea that some people on the spectrum, and even people who are not on the spectrum, respond sometimes to what I would call micro-dosing that I've experienced watching my own patients being treated. My own son, in fact, when he was much younger, started on Prozac, and they started him on like 5 milligrams, and he became sleepless. He couldn't sleep at all. We reduced his dose with using liquid Prozac, which was the only liquid one available at that time, to like 1 milligram, and bingo, it worked. it not only worked, but he was able to sleep and the side effects went away. But I've had other patients with other medications that aren't available for that go to what are called compounding pharmacists, who can reduce a lot of medications to a liquid form that you can then use an eyedropper and measure out very tiny doses. And there are people who are responders to these very low doses. And I don't often think that a lot of regular providers don't really consider that. They'll just give them the lowest available dose. And if that doesn't work, they say, well, it's not going to work for them. But I think sometimes workable medications are bypassed because of this.
Definitely, I see that too. I mean, it's all across. I mean, I think, like I said, the rule is kind of there are no rules. Forget the rules. Forget your expectations a little bit. I do use compounding pharmacies as well for some of my patients. It's kind of like you gotta be open-minded and be willing to be creative.
See, if there's a prescriber who's watching this who is interested in trying to prescribe a liquid formulation of one of these meds, is there a place you would point them to like learn more about how to do that?
I would say, just off the top of my head, Lexapro, fluoxetine, sertraline, Zoloft. They come as liquids. You're ordering them the same way you order your other medications easily at the regular pharmacy. Liquid can be nice also when you're tapering people off of medications. We used to think it's not a big deal to come off of antidepressants. Discontinuation symptoms are really rare, but that is because those studies didn't follow people who were on the medications for longer than like 6 weeks or 2 months, right? And now we have people on medications for a decade or more and trying to come off of them. So another point to bring up when we're thinking about liquid and we're thinking about compounding pharmacies is I use them even more frequently when I am tapering someone off of a medication who's very sensitive, and you often need smaller steps than is commercially available. And you can just Google compounding pharmacy near whatever zip code and find a pharmacy that, for example, especially the SNRIs can be tougher to taper off of. Your duloxetine, your venlafaxine, and it can make whatever dose of duloxetine or venlafaxine you want. And maybe you're tapering down by 10% at a time for a sensitive patient. And then your other patient, you can do your regular old hyperbolic, half the dose, half the dose, half the dose, and they're okay with it. And you adjust based on each individual. This person's fine with a rapid taper, that person not so much.
This video is part of a frequently asked question and answer series recorded live during an IOCDF OCD Autism Special Interest Group meeting. For more information, please check out the OCD Autism Resource Center on the IOCDF webpage. And while you're there, please sign up for the SIG email mailing list to receive announcements for future presentations.